All right, thank you, Abby, for those instructions, and welcome again, everyone. My name is Trinity Smith. I use she, her pronouns, and I am speaking to you from the ancestral lands of the Nisenan and Miwok peoples. I serve as the Health Program and Policy Specialist for the California Department of Public Health, Climate Change, and Health Equity section. I'm joined today by my colleague, Osamu Kumasaka, the Tribal Climate Change and Policy and Program Specialist of the Climate Change and Health Equity section, who will be guiding us throughout today's session. This meeting is being facilitated by our team at the California Department of Public Health. The Climate Action Team Public Health Workgroup is usually co-led by CDPH and the California Air Resources Board. Our work group meetings are designed to provide a forum for public health partners and other stakeholders to learn about and discuss timely issues at the intersection of climate change and health equity. Today's presentations and discussions will center on how tribes can plan for and take action to prevent the human health impacts of climate change, as well as what state and local governments can do to coordinate, collaborate, and support these efforts. But before getting into all that, we do have a few housekeeping items. So next slide, please. In addition to American Sign Language and Spanish interpretation, real-time captions are being provided today by eCaptions. You can find the closed caption feature on the bottom of your screen in the Zoom controls bar as shown on the slide here. And with that, we'd like to remind our presenters to speak clearly and at a measured pace for our captioner and interpreters. For this meeting, we have muted all attendees, but we encourage you to submit any questions you have throughout the meeting through the chat feature, which you can find on the bottom of your screen in the Zoom controls bar as well, also shown again on the slide here. And we ask that if you are not presenting or participating on a panel, please keep your video off. And to optimize viewing of whoever is speaking, we recommend going into the upper right-hand corner, clicking on the view icon, and select the side-by-side speaker view. And throughout the meeting, if you have any concerns or technical difficulties, please send a private chat message to my colleagues Dan Wu or Meredith Millette. And if you're listening in and you're a Spanish speaker, and you have any questions, send them to Abigail Ramirez. Next slide, please. And a portion of today's meeting will be recorded and should be posted online about a week after this meeting at this link on the slide. And I will go ahead and post the link into the chat as well. But next slide, please. I'll go ahead and turn it over to my colleague Osamu Kumasaka to share a land acknowledgement for today's meeting.
Thank you, Trinity, and good afternoon, everyone. My name is Osamu, and the pronouns I use are he, him. I am calling in today from the East Bay, from the traditional territory of Huichin, the ancestral land of the Chochenyo-speaking Ohlone people. I want to begin this meeting by acknowledging that the state of California exists on the occupied territory of over 110 federally recognized tribes and many other unrecognized tribes. This land has been stewarded by indigenous peoples since time immemorial. We acknowledge the critical importance of these lands and waters to the indigenous peoples of California today, and that the existence of tribal communities and preservation of traditional indigenous ways of life depend on secure and permanent land bases and the right of self-determination. Our team at OHE, the Office of Health Equity, recognizes the painful history upon which the state of California was created and how policies, systems, and structures continue to oppress and erase Indigenous peoples today. For the past 2 centuries, tribal communities have been displaced from and dispossessed of their ancestral lands. Sacred sites have been destroyed, and families and communities have been torn apart through residential boarding schools, relocation programs, and even enslavement. We further recognize the diverse Native American diaspora of California, including thousands who were brought here from elsewhere in the United States without their consent or through false promises of opportunity. In 2019, Governor Newsom signed an executive order formally apologizing to California's Native Americans for historical mistreatment, violence, and neglect. He also established a Truth and Healing Council to provide Native Americans a platform to clarify the historical record and work collaboratively with the state to begin the healing process. Our shared history compels us to grapple with this legacy, take action to interrupt the continued harm of colonialism and genocide, and to redress the erasure of Indigenous peoples. We are committed to working alongside Indigenous peoples and following their lead as they work to uphold their sovereignty, dignity, and identities. We seek to build authentic, mutual, and lasting relationships with tribes and Indigenous communities who work tirelessly towards justice and healing. Land acknowledgement is only one small part of supporting Indigenous communities. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. Solidarity can look like donating your time and money to tribes and Indigenous-led organizations, amplifying the voices of Indigenous people, leading grassroots change movements, and returning land to tribes. I am honored to help convene and co-host today's event. Next slide, please. And to start us off, I'd like to welcome Dr. Rohan Radhakrishna to provide some opening comments for today's meeting. Dr. Radhakrishna was appointed by Governor Newsom in early 2021 to lead the California Department of Public Health's Office of Health Equity, which includes our section, the Climate Change and Health Equity section. He also serves as the department's Chief Equity Officer and Tribal Liaison. He brings 20 years of experience working with impacted communities and previously served as co-chair of the statewide Health Equity Committee for the California Conference of Local Health Officers. Rohan spent 10 years at a local health department, most recently as Deputy Health Officer in Contra Costa County. His local experience responding to the COVID-19 pandemic, power shutoffs, wildfire smoke, and heat emergencies has solidified his commitment to addressing the overlapping public health crises of climate change and structural racism. Take it away, Rohan.
Thank you so much, Osamu. My name is Rohan. I stand for love, dignity, transformation. I use he, him pronouns, and I'm coming to you today on the Nisenan and Miwok ancestral lands from my Sacramento office. Our team at the Office of Health Equity is committed to working hand in hand with tribes to reduce the health disparities that American Indian and Alaskan Native populations face, as well as the upstream social and environmental conditions that create those disparities. Climate change refers to the permanent and cumulative disruption of weather patterns and not just mere temperature increases. Some of these changes include more frequent and intense floods, droughts, wildfires, storms, heat waves, and rising sea levels. These changes are becoming more dramatic across our state, are overlapping, and are straining governments and communities' capacity to respond. I've experienced this at the local level and now at the state level. Just within the past few weeks, California has been struck simultaneously by an unprecedented heat wave, multiple wildfires, a tropical storm that led to mudslides and debris flows in areas that were previously burned by wildfires, within a backdrop of a persistent severe drought, all exacerbated by global climate change and events that our team and department have been engaged in over the past days and weeks. These conditions, as well as the secondary impacts such as power outages, shutoffs, have far-reaching environmental, social, agricultural, and economic effects that are harmful to our health and our well-being. A journal in the study Science from 2021 which I'm placing in the chat, quantified what tribal leaders have been saying for years, which is that tribes in particular have been made more vulnerable to climate change because indigenous native land holdings in the United States have been reduced to nearly 99% over centuries of forced displacement from prior lands. And the forcible displacement has led to being on lands that are on average hotter, receive less precipitation, and more susceptible to wildfire than prior land. The disruptive effects of climate change and the resulting impacts on health and well-being tend to fall disproportionately to communities that are already disadvantaged by historic and current social, economic, and political oppression, including Native Americans. These disparities hinder our ability to prepare for, respond, and recover from climate events. Fortunately, many tribes in California have already taken the lead in planning for and acting to reduce carbon pollution, to adapt to climate change, and to mitigate the health impacts that we are already experiencing. You will hear a few examples of the inspiring steps that tribes are taking from our invited speakers today, but this is a small glimpse into the tremendous work being done across various tribes of our state. And I won't have time to mention all of them, but I'll mention a few. One is the Big Valley Band of the Pomo Indians, partnering with the Public Health Institute and state agencies as an effort to track and prevent the health impact of harmful algal blooms in lakes, which are worsening due to climate change. Just last week, our tribal equity lead attended the Truth and Healing Council that Osamu mentioned, their meeting in San Francisco. And it was the words of Chief Justice Abby Abenanti of the Yurok tribe that left ringing in our staff's ears. How did it get so messed up so fast? Referring to the green algae cyanobacteria in the Klamath River, but speaking to the broader rapid and destructive changes. Another example is the Karuk, Yurok, and North Folk Mono people, amongst many other tribes that are renowned for their expertise in utilizing cultural and prescribed burns to reduce fuel loads that make wildfires larger and more intense. Despite having spent decades overcoming official prohibitions that kept such land management practices from happening consistent with traditional values, these tribes generously share their expertise on climate-smart forest management with a wide range of audiences. Another is the Blue Lake Rancheria, located in a remote part of Humboldt, subject to heavy rainstorms, forest fires, and frequent power outages. They have installed a clean energy microgrid to allow the Rancheria campus to open in tandem without needing to require a utility grid from the outside. This is a carbon neutral, climate smart example that we can learn from various tribes across our state. Over the next hour and a half, we will uplift and celebrate tribes' efforts while asking you all at state agencies, local health departments, and other entities to do what you can to support tribes in these endeavors. State agencies such as us, the California Department of Public Health and the California Health and Human Services Agency, are taking stock of what we have painfully learned during the COVID-19 pandemic response, which did strike Native Americans and people of color and low-income jurisdictions first and worst. We saw higher rates in American Indians and Alaskan Natives throughout the pandemic of both disease as well as hospitalization and death. We must plan ahead to prevent similar disproportionate impacts from climate change. And I believe that one of our most valuable assets in this collaborative relationship that we forged with tribal partners to continue supporting coordinated responses and learnings for the future. We must maintain these channels to plan proactively and respond more quickly to future crises. I look forward to our department hiring a tribal coordinator in the coming months and working with tribes to create a tribal consultation policy in 2023 for the Department of Public Health. Our state has recognized that providing more funding and technical assistance is necessary to support under-resourced tribal governments as they plan to prevent climate change from impacting human health. For the first time ever, this year's state budget allocates funding to our department for climate and health regional resilience planning. Our program in development joins a suite of over 100 different climate-related grant programs offered by state agencies. We are interested in prominently involving tribes in our grant program by providing tribes with funding to work with local health departments and community-based organizations on regional climate and health resilience plans. As we ramp up staffing for this grant program during the first year, we'll be reaching out to get more input on how best to implement this program equitably and thoughtfully, and in a way that meets tribes' needs and bolsters the limited capacity that exists in least resource tribes, health departments, and community-based organizations. We look forward to fostering these collaborations and planning efforts to co-create a healthier and more resilient California with tribes, and hope that the presentations and conversations here today will inspire you all to take action. So I want to thank you all, starting with our staff, Abigail, Trinity, Osamu, our entire staff at the Climate Change and Health Equity section, our interpreters, Marlene and Maricela, our panelists, and all of you participants for joining us today.
All right, thank you so much, Osamu and Rohan, for that land acknowledgement and providing that statewide context for today's discussion. Next slide, please. So now I would like to welcome Dr. Eric Coles and Carrie Vera with the Tule River Tribe of California. Eric Coles has been working for the Tule River Reservation for the last 2 years as the tribe's public health officer. His initial responsibility was to address COVID-19, and he's now focusing on establishing the tribe's first public health department. And Carrie Vera is a member of the Tule River Tribe and has served as the director for the Department of Environmental Protection since 1998. Currently, Carrie serves as the Region 9 Environmental Protection Agency, EPA, Regional Tribal Operations Committee as a Central California Tribal Representative, as well as on the EPA Region 9 Tribal General Assistance Program co-lead. All right, so we will welcome Eric and Carrie and turn over the screen sharing powers to you.
Hi, sorry, this is Eric. It says I'm not able to screen share. The host is able to participate screen sharing.
All right, let's figure it out real quick. Sorry, everyone. Hold on a moment.
Great. Okay, so I could go ahead and start. Hello, everybody. Thank you so much for having us at your meeting today. We're excited to be here and happy to be part of this important conversation. My name is Carrie Vera, as was stated, and my partner here, Eric Coles. I'll let him introduce himself. I'm with the Tule River Tribe's Department of Environmental Protection.
Hi, everyone. Yeah, I'm with the Public Health Department, and yeah, as they said, I'm the Tribal Public Health Officer for the last two years.
Great. So yeah, today we're going to present really briefly the roles that we played and the efforts that we've been taking as we faced specifically wildfire threats and all that comes with that, as well as COVID here on the Tule River Reservation recently. Dr. Coles and I started working together specifically on air quality efforts, and our relationship quickly bloomed from there, and took on almost anything and everything that has to do with environmental conditions and how that's impacting our community health-wise. And so those things are so closely connected that our work is overlapping more and more, which is no surprise. I mean, our community's always been closely connected to the earth, our environment, all those things. There's no separation there. One impacts the other for sure. And so that's kind of a little background on us and how we started working together and partnershiping there. So if you want to slip to the next slide. For those of you that don't know, the Tule River tribe is comprised of multiple bands of Yokuts Indians. We are traditionally from the Central Valley area in California and into the Sierra Nevadas. In this map, you can see that we're situated right now in the rolling hills on the the western slope of the Sierra Nevadas. You can see the green Sierra Nevadas there, going up to the north and south of the balloon there. And that's where we've always been, even though we traded to the west of the coast and then over the Sierra Nevadas. Historically, we've dwelled here in the valley mostly. The reservation right now is about 56,000 acres, about 85 square miles. And you can go ahead and skip to the next slide. I wanted to give you all a visual. So the reservation comprises almost the entire South Fork Tule River watershed. So that's the reservation. If you see the pink boundary there, that pretty much follows all the higher elevation peaks of the watershed. And the kind of orange boundary is the reservation boundary. So you can see they coincide very closely, except for on that eastern edge there where it bluntly cuts off. We're missing about 9,000 acres of the upper watershed there only. So I wanted to show you this picture to kind of give you a visual of what we're talking about. So the reservation, just really quickly, on the east side is high. It's in the Sierra Nevadas, high elevations to just under 8,000 feet. And then as you move to the west, there's a downslope. The river flows to the west down, obviously. And then we've got rolling oak woodlands on the westernmost part of the reservation. And that's where everybody lives. That's where our community is. But the reason I'm bringing this up is to show the river canyon that it bisects the reservation. And so it creates this canyon, this V-shaped canyon, so that when we face things like poor air quality, smoke, those things settle in that valley where the community is. And so that's, I just wanted to show you guys that, give you a visual of that. I call it our own airshed. We really have our own little airshed here. And we've seen data show that it is different than air quality in other areas. So we kind of have our own little system going on there. And that's where our focus is when we work together. That other boundary, that kind of turquoise area, is the most recent fire boundary that Dr. Coles will be talking about later. So the tribe, just like the rest of California, has been facing drought for a while now, and eventually we faced our river drying in the lower elevations. That's never happened before, from what I can tell, from what all elders can tell. We always faced flood danger, flood threats to livelihood and that sort of thing. Now it's different. We are facing drought and lack of water, which has all kinds of different implications there. From the river drying to our conifer forest being parched and being left vulnerable to disease and fire threat. So all of those things have come with drought, increased algae blooms, like the gentleman spoke of earlier. We're facing those things. So we have a new world going on here. The decreased health of our forest has, left them vulnerable to the beetle kills. So we've seen increased tree kills. So those are the things that we're facing right now, the things that we're working hard to address. And yeah, so this was a great place to talk about them. And I'm going to go ahead and switch it over to Dr. Coles now to go into that a little bit further.
Thanks, Carrie. So Carrie and I are here today to kind of talk through what happened on the reservation last fall, almost exactly a year ago. There was the Windy Fire, was in part of the Sequoia National Forest, as well as areas on the reservation itself burned. So these are some pictures, both kind of from the edge of the reservation and also from down below, that shows kind of how smoky it was. The picture on the left is actually right in front of our health center, where we, I think very fortunately, got a temporary air quality monitor stationed for about almost the entire length of the fire. And that was really instrumental in helping us measure the air, monitor the air quality and see how bad it got. Fortunately, I don't think any structures on the reservation burned, but we were dealing with, obviously with significantly bad air quality. So with that air quality monitor that was next to the the health center, these are some readings. We got, I think, hourly readings from it. You'll see on the right, these are readings from our air quality monitor on September 24th of last year. You'll see the readings are well above the AQI, the air quality index, which is on the left. The highest level of the air quality index is 300 to 500. And we were near 700 on this day. I think this was the worst day, but we also had other days that were well into the hazardous levels in terms of air quality. And because we never had an air quality monitor, and environmental health is not my strong suit, we definitely faced a lot of open questions and concerns about how to best respond to this air quality issue. I also believe just at this day, on September 24th, I think it was the worst air quality measured in the US was on the reservation, because again, these numbers are just incredibly high and much higher than most areas see. So on top of that, or in addition to that, we were also obviously facing COVID-19, and we saw a significant increase in cases. So this shows the number of active cases that were on the reservation in that time frame. You'll see on the left-hand side of the graph, in early September, when the fire wasn't really that bad, we were just above 10 cases of COVID-19 on the reservation. And then throughout the month of September into October, cases climbed to nearly 50. We were in the high 40s around late September, early October. That was very high for us. It definitely caused a lot of concerns with the health department about what we should do. We can't, obviously say the wildfire caused it, but it obviously I think is correlated. You'll see, remember from the last slide, the really bad air quality day was September 24th, and just a few days later we hit I think our peak, which is like 48 in this season. So with that, I think we faced a lot of key questions that I think this group should be kind of thinking through, and I would love input and ideas about this. I think Carrie and I, as well as the elected health board for the tribe, were wondering what we should do for the community at this time. We were talking about opening a clean air center. I actually asked our emergency management director, and he said, well, we don't have any plans for COVID-19. We don't know what to do with COVID-19. So there was delays about opening a clean air center because it wasn't kind of like set up for COVID-19. We were also unsure about whether residents were willing to leave their homes. It was kind of what would we want, what do we need at the clean air center to kind of draw people out. It was the first time we had air quality monitors. on the reservation. So there were concerns about how people were interpreting it and unsure of it, unsure of what like kind of the data meant. We were also wondering, there's staff like myself who come to the reservation to work, and we were wondering, should we close the offices? Should we have staff come? You know, is it kind of worth dealing with the poor air quality? I believe the health center even closed one day during this event because of how bad the air quality was. And then, you know, obviously on top of that, we were wondering what COVID-19 policies we should implement at the same time. We still had mask wearing back then, but we were wondering about other potential issues. So I don't think we ever really resolved these questions. I think we did the best we could with them, but I would say a huge help was through the California Rural Indian Health Board. They provided, I think it was about 10 or 12 air scrubbers that we gave to some of the households and some of the offices to make sure that indoor air quality was at least clean. We also opened up a clean air center temporarily for one of the weekends that the air was really bad. So I think that was kind of the best we did, but I think it was a really concerning time for a lot of the staff and for the health board, and made us really think that we needed to plan better for environmental health issues for the tribe. So I'll turn it back to Carrie to talk about what we did after the fire ended.
Sure, yeah, thanks, Eric. I wanted to show these pictures really quick just to kind of, you know, just to show the effect of the fire. This is in upper elevations. The one on the left, I hope you guys can see, but I liked it because you can kind of see that haze. If you look off into the distance past the mountain line, the ridge line, you can kind of see a haze, and that's fairly typical of the San Joaquin Valley. So on top of living right near in a valley that is a bowl and collects these things already, just upgrade a little bit from there is where the community is. So if you kind of look over this little knoll that I'm taking the picture on, that down there is where our community is. So it just kind of gives you an idea of kind of the landscape there. And then the one on the left is just, you know, one of the extreme areas of the reservation that burn, where there's just, you know, just nothing left. And you just imagine all of that, you know, it's really sad that it burned, but all of that goes up into the air, into the smoke, and down onto the earth again. So I just thought these pictures were a nice visual aid. So we can go ahead and move on. So just moving forward, like Dr. Coles was saying, you know, this is, you know, fairly new for us, all these things coming together at once and really scurrying around and trying to react. And COVID just really, you know, made things more complex. We weren't able to gather in the air stations. When I first asked my supervisor to do it, the answer was just, no, we can't do it with COVID. So, you know, that's what we're dealing with. And on top of that is the community. They really prefer to stay in their homes, you know, especially the elderly. The tribe had offered some hotel rooms in places with better air quality, and there really was not many takers, and people just really, this is their home, nobody's leaving, and they just go on with their business. And, you know, air quality impacts in some ways are unseen. You know, if people are able to live and breathe and keep moving, they just choose to keep doing that. And so we're having to be creative there and trying to get that education out there. And that's kind of leads me to this slide. That's what this really effort was, is to kind of combine all the relevant community health information that we have and put it all on one snapshot to help get this out to the community. It's an easy read, you know, easy on your eyes. This was created in conjunction with a summer intern, I believe, from Crib. She really did a great job here putting this together, you know, gleaning through all the data that we have and making it a nice visual educational piece. So this has been going out, I believe, weekly on social media and just everywhere we can put it so that the community can see it and have a really great quick view on things. And I see your message that we should hurry up. So just really quick, yes, we're moving forward. We have a little team established with myself, our public health authority, Dr. Coles, and then we've teamed up with some professors at Stanford, and we've put a grant proposal together with EPA to try to come up with some plans, some mitigation measures that we can help address these impacts on community health and how we can react in a way to help lessen that strain on our community. So increasing air quality monitoring and then increasing community outreach and communication and really trying to be creative and help enhance our community health in the face of all of these hazards. So I don't want to keep going on, but trying to talk slow, but be in a hurry at the same time. So thank you everybody for listening. Oh, and
Thank you both. Go ahead.
Oh, I was just going to say there's our contact emails if people have further questions.
All right, great. Thank you both. And we will have time later to hear more and ask questions of Eric and Carrie. So we will go ahead and put your questions in the chat, but we have more time to hear from them. So thank you both. And now I'm going to pass it over to my colleague again, Osamu, to give an overview of tribal health and climate planning and some of his current work. So over to you, Osamu.
Great. I hope everybody can hear me okay. Hello again. I am, as Trinity shared, our tribal climate specialist, which is a relatively new position and a new role for our team. So our section in the Department of Public Health is a small but robust team of, I think, 7 staff and a couple of fellows. And we focus on upstream policies, systems, and environmental change to assure that California's actions to prevent and prepare for climate change improve health equity. Today, I will give a high-level overview of the kinds of climate-driven health impacts we are working with tribes to prevent. I really appreciate Dr. Cole's and Carrie's snapshot of a particular moment in time that led them to realize what kinds of health impacts they might see. And there's often these cascading and overlapping impacts of climate change on tribes. I'll also cover this kinds of support that I've been providing to tribes over the last year, and then we'll briefly touch on some of our climate and health planning resources and tools. Although I'd encourage you to reach out to me if any of this is interesting to you. I'd also encourage any tribes that are represented here today or tribal staff to go into the chat and just say hi and introduce yourself and where you're calling in from. Our team's priority, like I said, is embedding health and equity into climate change programs and policies so that implementation improves living conditions for communities facing inequities. Listed here are some of the state plans and programs we've worked on with the agencies that are involved in parentheses. I won't go over them all, but we'll just highlight that we have worked with the Natural Resources Agency and the Governor's Office of Planning and Research to update the state's climate adaptation strategy as one project we've worked on. The climate adaptation strategy, which was released this year, prominently features the wisdom of tribal input gathered during listening sessions and incorporated into the strategy. We're hoping to see concrete improvements for California's tribal communities as the goals in the strategy are resourced and implemented. Additionally, our team works to increase the capacity of local health departments, tribes, and tribal serving organizations in planning for climate-related health impacts. We do this by providing technical resources, data, and tools to support their efforts, including our California Building Resilience Against Climate Effects, or CalBRACE adaptation toolkit. We also encourage tribes' participation in state and federal grant programs that can help fund this work. Relevant grant programs include those listed here. Our team has advised other agencies on incorporating features that advance health equity, including prioritizing communities for investment based on our climate change and health vulnerability indicators and the Healthy Places Index, which I'll show in just a moment. I've been working on coordinating with the tribal technical assistance providers that these grant programs are increasingly hiring and bringing on board, and orienting tribes I'm working with to these opportunities as they arise. We use this graphic to demonstrate the full spectrum of the different ways that climate change can harm human health. Climate change, as you'll see, not only affects the physical health of human beings, but can also harm our mental health. So that pink ring around the outside. Climate change can cause and intensify stress and anxiety. For example, extreme heat has been associated with a range of mental health impacts in research over many years, including increases in irritability, symptoms of depression, and suicide rates. Furthermore, the grief and stress many of us feel when thinking about climate change, I just note, has acute focal points for Native Americans as it threatens their cultural resources, traditional sources of food and medicine, culturally important sites, and the practice of traditional lifeways. Climate-related health effects are usually felt first and worst by those already facing inequities, including those living in poverty, those without housing, low-wage outdoor workers, those who are socially isolated, and communities of color, including Native Americans. Due to structural racism, colonialism, and ongoing disinvestment, which I mentioned during our land acknowledgement, Native American communities are more likely to be living in poverty. People living in poverty have a harder time adapting to environmental changes. So for example, Native folks have less access to air conditioning, electricity, and running water. And people without access to those kinds of air conditioning and other household amenities are at increased risk for hospitalization and death during heat waves. We've learned during the pandemic that poor air quality increases the risk of illness and death from COVID-19, demonstrating the confluence of impacts on these communities. The intimate relationships between the environments we live in and our bodily health is a core component of many indigenous knowledge systems, which makes planning for climate change from a human health perspective an approach that tribes often find intuitive or even obvious. As Rohan described earlier, several tribes in California have already taken on planning for and acting to reduce carbon pollution, adapt to climate change, and mitigate the health impacts of climate change in ways that are both innovative and grounded in tradition. Our team has been working with the Tribal Climate Health Project of the Pala Band of Mission Indians, who we'll hear from a little bit later, and other partners over the last year to figure out what role we can play in supporting more tribes and tribal serving organizations who are interested in confronting these challenges, and particularly those with limited resources and capacity. So if you are a tribe or a local health department that is relatively new to this topic, where do you even start? What or who should you be most concerned about? We'd suggest that you use our climate change and health vulnerability indicators, or CHEVs is our cute acronym, to get oriented. This is a tool that can help you define and visualize the scope of climate impacts and identify the populations and locations that are most vulnerable to those impacts in your area. You can view and explore the climate change and health vulnerability indicators on our CHEVs data visualization platform on our website. And I think we could put a link to that in the chat for you. The CHEVs indicators are grouped into 3 types. So environmental exposures, adaptive capacity, so our ability to respond basically, and population sensitivity. Many of these indicators are available at the census tract level, and others are at the county or regional level. The data are available to download in Excel spreadsheets from the website, along with a description of why each is relevant to climate change and health equity. Another tool is the California Healthy Places Index, or HPI, which is developed by the Public Health Alliance of Southern California with input from our team. The HPI explores local factors that predict life expectancy. So their index includes 25 different indicators weighted to maximize the overall score's association with life expectancy at birth, to rank census tracts in California according to their degree of health promoting factors to guide investments that the state and other actors are making. And it provides policy actions as well on factors that shape health, like economics, housing, transportation, and education. So our climate change and health vulnerability indicators are included as a separate decision support layer. So they've actually been integrated into this tool as well. And it's really incredible, and I'd encourage you to look at that as well and use it to generate visuals for your maps and other kinds of projects that you're working on. Finally, I just wanted to give a little insight into my work over the past year supporting two tribes, the Mono Lake Kutsadika in the Eastern Sierras and the Redwood Valley Rancheria in Mendocino County. I've been providing technical assistance with their climate-related planning, and though this work is very much in progress, I just share some brief updates. With Mono Lake Kutsadika, I've been helping Dean Tanena, who's a tribal member and experienced botanist, who will be speaking in our final panel today, as well as Lori Montserrat, who's with Cal EPA's Office of Environmental Health Hazard Assessment, to work on a tribal climate vulnerability assessment and a climate adaptation plan. This tribe is very small and has no full-time tribal staff. So I want to celebrate Dean's labor and the foresight of their tribal chairwoman, Charlotte Lang, in taking on this relatively big lift in terms of, the kind of work that will ultimately help their tribe plan for the future. They've actually been profiled in a local paper, which we're hoping will help raise their profile to support gaining federal recognition as they are an unrecognized tribe. And then with Redwood Valley Rancheria, I've been working with the environmental director, Adam Coleman, on a similar planning process. I think one thing I'd highlight about that work is we have submitted a health data request to the California Tribal Epidemiology Center, or CTEC, which is a group that can help actually assess population sensitivity in a study area, and their services are free for tribes that submit a request. Both tribes hope to document their plans in multimedia formats using GIS story maps in addition to standard written documents, and they hope to engage tribal members and elders to have their stories and traditional knowledges incorporated into the planning processes. So please do reach out to me. I'll put my email into the chat if you are a tribe or a tribal serving organization. Thank you.
All right, thank you so much for that, Osamu. And I want to welcome our next speaker, as she has a hard stop at 2 p.m. and has graciously been willing to work with us and give a presentation with some information we think will be beneficial and of interest to this audience. So I would like to welcome Katrina Leni-Konig. She serves as the California Energy Commission Deputy Public Advisor and Tribal Liaison. Katrina supports tribal engagement and helps to shape grant funding programs to increase tribal participation in Energy Commission programs and accelerate adoption of clean energy technology. So over to you, Katrina.
Thank you, Trinity. Can you all hear me? I have some noise in the background. Are we okay? Can you hear me? Just checking in.
Yes, we can.
Yeah,
Sorry.
sounds good.
Thank you. Okay, good. I do have a hard stop. I'm gonna go ahead and share my screen, and I will add a 5 more minutes if I can, because I think this is a really great conversation, and I'd love to add energy into this conversation as well as we think about health impacts and the future of our climate and environment, and how climate change has also led to challenges when it comes to clean energy. And so the Energy Commission is developing programs that both address numerous things. Let me pull up my slides 1 second. All right. Can you see my slides? Yes. Okay. And Give me a second. I'm struggling a little bit here today.
If you go to a slideshow,
Where is it?
slide
Okay, there it is.
shows
Perfect. Okay, thank you.
yes.
Of course, when I'm on the spot, there it is. Okay. So just wanted to share. So the CEC invests in programs around clean transportation, building decarbonization, energy innovation, climate change, and resilient clean energy. Highlighting, of course, we know clean transportation is directly reducing air pollution, building decarbonization as well. So as we move to electrify buildings, which means getting buildings off of natural gas, we are reducing the impacts to the environment, but we're also reducing indoor air pollution. So cooking and so forth also adds to air pollution within the home. So we have programs and funding to do that. I want to share that we have worked with Prosper Sustainably, Strategic Growth Council, and others to develop a California tribal gap analysis related to energy and climate change. And this analysis is helping us to identify needs, priorities, and barriers with regards to climate and clean energy for tribes. Over 70 tribes responded to the survey, and the draft report should be released soon. So we're really excited about that draft report. We're gonna use it to help us shape state programs and fill those gaps. So I wanted to highlight a few funding opportunities. We're working with our partner agency, the Office of Planning and Research, to develop a tribal research grant program to help inform the 5th assessment for climate change. The CEC is responsible specifically for the grant program. There will also be a tribal advisory group. So I want to announce it to everyone. We are still accepting nominations for the tribal advisory group. We are seeking tribal representatives that have knowledge around climate change, around initiatives such as what Tule River presented, and in regards to restoration of ecosystems and so forth. And the funding program is specifically focused on investments to build capacity for traditional ecological knowledge around climate change, to include as well fund projects in related to traditional ecological knowledge. And feel free to reach out to me if you're interested in learning more. We'll be shaping and scoping that grant program in the next few months. So you'll hear more announcements around that as well. So another announcement on the nominations, the deadline has passed, but we're still accepting nominations. So feel free to reach out to me or Patricia Kennedy at OPR if you're interested in participating in the Tribal Advisory Group for the 5th assessment for climate change in California. Just wanted to highlight one particular project in this conversation. It's Blue Lake Rancheria. They received funding for a microgrid a few years back, but I wanted to highlight this because the impact that energy has on our communities is really important when it comes to health. And so this particular project was able to support the community when the power went out back in 2017. And what happened was when the power went out, Blue Lake was the only place where people could go to get ice to preserve their food. They also helped to save 4 lives that were on life support systems during that power outage time. And so there's a real connection when it comes to energy resilience and health. And so we're looking to support and invest in projects that provide energy resilience in communities, and so that we can ride out and be more resilient through times of crises. We've invested quite a bit of money throughout the state. There's more microgrids that have been invested in, and more to come, hopefully. And we're also investing in other areas. So this particular pot of funds that was invested with tribes in microgrids comes out of our research and development program. It's our EPIC program, but we're looking to do more through other programs as well. Currently, we have the build program. It's investing in building electrification and provides funding for things like induction cooktops, which reduce indoor air pollution. It provides funding for energy storage, solar, charging stations, etc. All of the above when it comes to new building development. And so if you have any new buildings being constructed or in the pipeline, let us know. And there's funding available to provide technologies for building electrification. Another program that's coming up is our ECA program. So it's related to energy efficiency and building electrification, funds similar things as the build program, but this is for existing buildings. And it's also a loan program, so low interest loan program. And it's a revolving loan fund. So all the money that gets paid back gets replenished and can get passed on to other people as well. So it's now eligible for tribes. It was only for local governments in the past. And just as this recent legislation made it so that this program, tribes are also eligible. So really excited about launching that soon. We're having a tribal listening session on both the ECA and build program. So these are those sort of building electrification programs on September 29th. So that's next week. If you haven't heard about it, but you're interested, or you know folks in the housing department that may be interested, please let them know about this listening session next week on the 29th from 2 to 4. I'll also share, working in partnership with CARB, we do invest in clean transportation. I wanted to just remind folks about the Clean Mobility Options Program. It's going to be opening again in November. And so that's a first come, first serve. You'll want to get prepared for that. And you're able to also connect with me. I can put you into contact with the program leads if you have any questions on that program. And then other ways to stay connected. I'll share these slides with the team today, but we have a site that has grant funding programs. You can sign up for it. It'll send you notifications. It's not just CEC grants, it's throughout the state. It also includes federal funds, and you can sort by areas of interest, but it's mainly focused on energy and sustainability funding programs. And you can also look for partners. So it's a kind of a networking platform. You can look for different companies, technology companies. You can look for consultants. You can look for other partners, program partners that are interested in some of these funding opportunities. And with that, I just want to thank you. I do have to hop, but I'm really excited to share this. That was just the tip of the iceberg in regards to programs. There are a ton of programs that the CEC has, and I'm just gonna show you my list of programs that I have highlighted for tribes when I go out to meet with them. We have a ton of opportunities in clean energy, and I'm the tribal liaison for the Energy Commission. So you're welcome to just reach out to me. I know how to connect you to the right folks. Thank you.
Thank you so much, Katrina, for covering so much in such a short amount of time, and for taking the time to be with us today. I would now like to welcome Dan Wu, the team lead with the Climate Change and Health Equity section here today, to go over another state funding opportunity.
Great. Thank you, Trinity. I try to slides here. All right. So I am speaking today from the ancestral lands of the Nisenan and Miwok tribes, and really appreciate the comments from our colleague Katrina at the Energy Commission. So from a climate health and equity perspective, what Katrina shared and what I will share about the state's newest, one of the newest climate grant programs, the Community Resilience Centers, or CRC program. These are examples of upstream strategies that can ideally help to advance racial and health equity through climate action planning and investments. When developed with meaningful engagement with tribal and community partners and with intentionality towards health and equity outcomes, these types of statewide grant funding programs can help to prioritize and direct resources to communities facing inequities in order to improve living conditions, build community resilience, and help to prevent the worst health outcomes and protect from the unavoidable health impacts of the climate crisis. So our CDPH Climate Change and Health Equity section serves on the CRC program's Interagency Advisory Committee, providing input and support in developing this program. And I am presenting on behalf of our partners at the California Strategic Growth Council, or the SGC, who were not able to join but have prepared some slides about this new grant opportunity available to tribes and other partners. Thank you to Coral, Abbott, Lisa Hu, and the rest of the SGC team for helping provide that information. So the program itself will provide funding for the construction or retrofit of facilities to serve as centers that communities can go to during climate or other emergencies, as well as spaces that deliver services and conduct programming that helps to build community resilience during non-emergency times. So examples of center functions can include providing hydration stations, serving as cooling centers, clean air centers, respite centers, and community evacuation and emergency response centers. Community resilience centers, or CRCs, should be trusted community spaces and ensure that they are accessible to the most vulnerable members of a community. Some examples of trusted spaces include the community or cultural centers, libraries, places of worship, and schools. But ultimately, locations should be decided based on what makes the most sense for that community. In addition to the building itself, CRCs can include amenities on-site or directly connected to them, such as transportation to and from the centers. The Strategic Growth Council also anticipates these centers providing services like food and water distribution, disaster preparedness training, and programming that supports community resilience. And these programs might be ones that help build people's individual resilience, like workforce development programs that help them move into living wage jobs, or native plant and food production programming that will support food security while also help to build social cohesion and overall health and well-being. So the CRC program requires multi-stakeholder partnerships and community member involvement in the decision-making process for designing and implementing the centers. This means that applicants will need to bring together a group that includes community members as well as organizations that represent them to develop the program, to develop the projects that are proposed and to see those projects through implementation. Applicants can build on existing partnerships to form the application team. It can include other tribes, local, state, or federal partners, universities, utilities, small businesses, and others, depending on what makes the most sense for your local context. The CRC program intends to award at least one California Native American tribe per funding round. Technical assistance will be available for those applying to the program and to support with implementation. And the program will provide both planning and implementation grants. So in round one, the program has a total of $110 million available. The second round has $75 additional million available. And the round two guidelines revisions will begin after the announcement of round one awards. So this includes grants, program administration, technical assistance, and evaluation costs all rolled together. And in terms of the timeline, the Strategic Growth Council had conducted listening sessions over this past summer, including at least one tribal listening session to inform the development of the program. They plan to release draft guidelines in the fall and then take the final guidelines to the SGC's council in February of next year, release the application in spring, and make awards late summer of next year. So for any questions or follow-up, please don't hesitate to reach out to SGC program managers, Coral Abbott or Lisa Hu. And thank you very much. I'll turn it back to you, Trinity.
Thank you, Dan, for covering that for us. And thank you, everyone. We have come to the end of the first half of the meeting. We're now going to take a short break, and we will plan to resume the second part of our meeting promptly at 2:18. So see you back here at 2:18. Thank you.
lead of the Tribal Working Group for the Climate Science Alliance and a member of the Institute of Tribal Environmental Professionals Climate Change Advisory Committee. Dr. Gaughen also oversees the Tribal Climate Health Project, a grant-funded education and outreach project that provides resources on climate change and health adaptation in tribal communities. And she's also just such a fun person to work with. Welcome, Shasta.
Thank you, Osamu. I just finished eating salad, so I apologize in advance if I have salad in my teeth. And since you're all friends here, you'll be sure to tell me. Let me share my screen. I do have a few slides, and I want to talk to you primarily about what we have developed through the Tribal Climate Health Project. And I'm trying to go full screen here. How am I doing? Let's see. Nope, that's not what I wanted to do. There we go. Okay, so, Osamu gave you some of my experience, but for the purposes of this working group meeting, I wanted to talk a little bit about the work that Paula has done on the Tribal Climate Health Project. So Paula is in San Diego County. This is ancestral Payom-Kwichum or Luiseno territory, and Paula is both Payom-Kwichum and Kupangawachum or Luiseno and Cupeño people. And about 6 years ago, we started the Tribal Climate Health Project with funding from the EPA, and following that with funding from the BIA and the National Indian Health Board. And as part of that, we became involved with the California Department of Public Health and have been working with Osamu and his colleagues over the last couple of years. And what I wanted to talk about was some of our network and resources that we have developed in that time. So this shows you the structure of what we have developed here. We work very closely with a consulting firm, Prosper Sustainably, primarily with Angie Hacker, who has done a great deal of the work that I get to claim credit for as the director, but Prosper has been our 100% partner on this to do a lot of the work. And we are working on this because it's important to have climate vulnerability and climate adaptation capacity for tribes. So we began by doing a vulnerability assessment for Paula, and then from that, developing our tribal climate adaptation plan. And we use that experience to create capacity for other tribes to do the same. So we have a website with multiple resources. We call it a resource clearinghouse. It's searchable. We're actually in the midst of updating our website so that we can make it even easier to use. We also have training tools, companion tools, various templates. And so I want to talk about a few of those here. But first, I want to just make sure that we have the context of what climate change means for tribes, for Indigenous people, for tribal communities. Obviously, climate change does not care about political boundaries. It's happening everywhere. But the communities that it's affecting have unique circumstances that need to be addressed. So climate change adaptation for a community that has a lot of resources may be less of a lift, even though the effects might be similar, than what might be happening in a tribal community where there are fewer resources and you're already dealing with issues such as disproportionate health outcomes. We saw that during COVID, when sadly I just read an article in the last couple of weeks about how the reduction in life expectancy in the United States had the largest effect on tribal folks. They lost the most years of life in life expectancy. We're dealing with water and food insecurity, the possibility of communities actually being displaced, whether it's because of sea level rise and melting permafrost that we're seeing in the Arctic, or whether it's a lack of access to clean water because of drought conditions like we're seeing in the Southwest. There's also the importance of understanding tribal sovereignty, the federal-tribal relationship, and that the loss of ecological health is also a loss of cultural health. That for tribes, the environment is not just about trees, plants, animals, rocks, something that is separate from culture. They are the same. These are the non-human relatives. This is water that gives life, air, same thing. The places where creation happened, whether that's a creation place that's a mountain or a lake shore or even a sunrise. So these are all things that need to be considered as part of climate change adaptation and assessing tribal vulnerabilities. Within our framework, when we're talking about the actual climate exposures, we broke it down into these 5 exposures you see on the right. Temperature, which obviously is heat for those of us in California, but it can also be changes of other types in communities that might not be heat. It might be changes in when the temperature changes. It gets warmer sooner, that kind of thing. Wildfire, obviously a big thing. Storms and flooding, drought, and then of course, melting ice and sea level rise, which is what a lot of people think about when they hear climate change. And then what are those secondary effects from those exposures? Air quality gets worse. We have new diseases that might come in with mosquitoes and ticks that might not have been in that area before climate change. Water insecurity, food insecurity, there are others, those are just a few. And then they impact our natural environment, our social or our built environment, but also the health and social environment. And that's both physical health and cultural and spiritual health. And then tied to all that is socioeconomic health. When people are struggling to feed themselves, when they're struggling for healthcare, then climate might not be at the top of their list. And so that's something else that we need to address. So for a tribal example for Paula, this is what we have determined, that our biggest effects are what you see here: the worse air quality, the vector changes, the water insecurity, and to some degree, we also have food insecurity. And so we've been working on that. And the tools that we have developed for Paula are things that we are sharing with other tribes through the resources provided by the Tribal Climate Health Project. So this is the essential framework and the best practices for developing vulnerability assessments and adaptation plans, but also for incorporating health into your adaptation planning. And so I highlighted this. We've got the exposures, impacts, and strategies inventory. We call it the EASY tool that is available to anybody. It's an Excel spreadsheet that is on our website, and it provides all sorts of exposures and then the places that you can go to determine how are those exposures affecting particular parts of the country. Sometimes they are as specific as tribal lands themselves. Sometimes they are more broad, like the Southwest. But these are places where you can go and plug in your geographic region and say, what are we seeing as far as heat over the next 30 years? And you can get a model of how temperature is going to change in your region. And then there's also resources for how you can adapt ideas and tools for adaptation to heat or to sea level rise or to vector changes, and also educational materials about, okay, what's a vector? Well, that's a mosquito, or it's a tick, or it's an animal that can transmit disease to humans. You might not have had to worry about Lyme disease 10 years ago, but maybe you do now because climate is bringing those ticks into your region. So here's a screenshot of our resources clearinghouse, and you can suggest resources of your own if you don't find them. But over here in the search area, you can put in your region, you can put in heat, you can put flooding, and then you can also narrow it down with filters to topics or types of materials. We have other tribes' adaptation plans that they have made public, so you can see how somebody else has done it. You can narrow the areas served. So if you're just interested in California, you can do that too. Something else we've developed is a form where you can access data from the Tribal Epidemiology Center, where you can ask for the data on your area on certain health outcomes and help that inform your vulnerability assessment. And that also lives on our website. So here's just a list of some of the things that we provide at the Tribal Climate Health Project. I already mentioned the EASY tool. We have a survey template. So if you are surveying your community and you want to know their priorities, that's really important. When we did the one for Paula, the thing that was the most important to the tribal members who took our survey were not the things that I expected. I thought they were going to be most concerned about drought because that's one of my biggest concerns. It turned out their biggest concern was wildfire. So if we hadn't done that survey, maybe I would have focused less on wildfire, but that's not what the community has at the top of their mind in terms of their concerns. We have the Paula Vulnerability Assessment and Adaptation Plan as a download so that you can see how we incorporated health impacts and strategies. And it's a Word version, so I joke, you can just do a search and replace with your own tribe's name, and then you've got a vulnerability. No, I'm kidding. It doesn't really work like that, but it gives you a good model. We've developed fact sheets that we provide to the community through our website, talking about extreme heat, wildfire, the other exposures. We also have a how-to on how to develop a family emergency plan so that the community is prepared ahead of time for what might be coming, and they are ready when that wildfire comes or when that high heat event happens, like we just had a few weeks ago. I sadly had a loss during that heat wave. One of my chickens succumbed to the heat. And okay, I mean, it's not funny. She wasn't my pet. She's an egg layer for me, but it was still sad. But if my chicken is vulnerable to the heat, that means your kids are vulnerable. That means your elders are vulnerable. It means even that your dog and your cat may be vulnerable. So you have to have that plan. You need to know where to go. And these are the sorts of things that we are continuing to push out through the Tribal Climate Health Project so that we are able to assist as many tribes as possible with developing their own strategies for the changing climate. And I'm going to wrap up there. I am delighted to answer any questions in the chat. And I'm also going to be sticking around for our next panel. So Osamu, I'm going to turn it back over to you.
Thank you,